My name is Jackie Dahlhauser, and I've been going to school for nursing for the last 5.5 years. I worked as an LPN for 2 years while I was getting my associate's degree. I graduated with my associate's degree last June and immediately started a week later in the bachelor's program here at the UW Tacoma. I decided to get my BSN because I eventually want to get my doctorate and become a nurse midwife, so this is kind of a stepping stone for me. The faculty here are so wonderful. They're really supportive. They treat students like we're all part of a big family. I never have any problem getting my questions answered, or if I just need some encouragement and I'm sending an email going, I'm so frustrated, I don't know where to go from here. We even have one faculty member that gives out her home phone number so that if we happen to be working on a paper over the weekend or at a time when she's not at school, we can always get a hold of her. I think that the one word that I would use to describe the UW Tacoma's nursing program would be community. And if I could do 2 words, I'd be community-oriented. Other BSN students have supported me by being there and going through the same thing that I'm going through. We all kind of help each other. There's a lot of group work. It's nice to kind of bounce ideas off of each other and just be able to give that supportive phone call in the middle of the night at 2 a.m. before the papers due. My classes have changed the way that I think in my practice at work. I've really learned to research the interventions that I'm going to do and the care that I provide to my patients. The one tip that I would share with a new BSN student is to start early on all papers as soon as you get the assignment, and then take everything one day at a time. Sometimes it can seem overwhelming, especially going full-time. The teachers give you all the tools and all the skills to be able to write them, and it's really not so bad if you can just get yourself going. The Writing Center has been really, really helpful, especially being able to do it online, sending papers to them and having them send feedback back is really great. Living in Auburn and having to commute to Tacoma, it would have been really hard to always have to make appointments and come in and see somebody face to face. The memories that I would take from the UW Tacoma really revolve around the friendships that I've made. Going down to the Harmon and eating lunch together in between classes to kind of relax and then go back up. We've even convinced faculty members to come down and eat lunch with us, so it's really fun to kind of get to know people outside of just the teaching role. I think that this would be the best place to come going from an RN to a BSN, because I have learned so much about what it means to actually be a nurse. I think if you don't have your BSN, at least my experience, the ADN, it's just teaching skills like how do you put in an IV, how do you take a blood pressure, but you don't really get any of the reason behind why you're providing the care that you are. I feel like I really got a solid foundation here at the UW Tacoma.